assure you that happens quite a bit. I also had a question about can you do this kind of work with people that you're close to? And I thought that was quite a good question, so I'll bring it up here. Of course you can, but you have to be very, pardon me, thoughtful about it. You're taking up an important position in their inner world, and if you're not prepared to go all the way and do all the work, I wouldn't even begin. Because there's nothing more frustrating to the person in need to have someone bail out halfway through, because either they can't handle it or you're both going to a place where you get lost. That's why it's extremely good to have a good assessment and to know as much as you can about the person you're helping with trauma. The more you know, the better off you'll be. Why head out down the expressway at 100 miles an hour if you don't know where you're going? Because that's what tapping can do sometimes. It's a very powerful thing. Any other questions before I amble and free associate through my 12-page handout? No questions? Okay. This is Gary's seminar, and I think the most important thing is to associate EFT with this kind of work. If you just take home the idea that in a very simple way you can use a focused technique in your own method, in your own style, and integrate a lot of meridian stimulation into what you're doing, I think you'll be quite successful. I was fascinated to see Gary doing double tapping and lots of the head point. I've been using double tapping for years. I've never seen Gary do it before. Maybe he was watching some of our videos. And I think it's extremely effective. And you know, you're halfway through the setup and off you go into the tapping. Of course. Pat. Yes, Pat.
Callahan started with the double tapping, as I remember, in 1986 and 87. And then he went all over the place. And I don't know what he's doing now, but that's the way I originally learned. And I had to unlearn it when I converted from a kind of technique I'd been using, which was a form of Callahan's, over to EFT. Then was the first time that I ever did the one side. But the top of the head, Gary brought in about, well, he was doing it 3 years ago. I remember him beginning to do it then.
Michael Gandy told us about that at San Francisco in '97.
Yeah.
Yeah.
Right.
Do you have any comments about this session or any questions?
No, I don't really have comments. I think it was moving. I think it was difficult. I think it was almost courageous to go, and I'm speaking now as a therapist, from a therapist standpoint, to go into what is such a tremendous picture and still be able to bring out of it something that was positive, really positive for her, even though you can't solve the big thing. And I think that's a challenge here, that well, there's several of us, for example, that take people out of the room when they're having real crises here. And it's been a challenge to help the person really get something, even when you know that this has got to be more work, and it should be probably, in many cases, work with somebody, with a professional. So I was very, I was really surprised at the amount of resolution that seemed to come from it.
And what did you think about the amount of focus I placed on the negative?
I thought it was not a great deal of focus on the negative. I thought it was a real balance between the two. And I felt it was a relief to her, because people can go around those things and not really, she had that feeling. She should have gone first and not that child. And you laid it out, but you did it very gently. You really did it. You may not know it until you see the film, but you did it very gently. And that's why she accepted it. You didn't push it on her, but you let it be there, and she got it. So I felt that that was very, very important. It was a very important truth that was expressed, and And then there was the intangible thing, which is the relationship and your caring, and it got across to her very strongly, I think. And she allowed, you could see her opening up and talking in a different way. And I think something did happen that was very, very critical here. So I was impressed and I learned. Thanks.
Thank you, Pat. Steve Wells and I like to work with the negative. We like to work with the dark side. It's not so scary. It's not so scary. It's what they're thinking and feeling anyway. And it is a tremendous relief for the person to know that someone else knows. And you can actually deal with it in almost a neutral fashion. With tapping, you can actually get to the neutral position where you reconcile the opposites quite quickly. I personally think this is the direction that this kind of therapy is heading toward, where you reconcile opposites. And at that time you head into a place which is, it's peaceful, but it's actually full of a certain kind of love. John DeMartini works in this fashion. It takes him hours to reconcile all the opposites in a person's problem. But when they do reconcile them, when they do really feel each and get balanced, then they're at a different place. It's just incredible. But I think with tapping you can get there very, very quickly. This actually brings up what I think is the most important part of treating trauma, and that's the relational aspects of doing this work. If you, for one moment, lose this connection, rapport, it's a heart connection with the person you're working with. If you lose that for one moment, then you're in trouble. And they'll feel that you've lost it, and you'll have to get it back very quickly. Unfortunately, in my profession, it's quite common that not only do you not have the rapport in some of this work, but the re-experiencing of the trauma is re-traumatising. I mean, how useless is that? I've even done this myself. I feel really uneasy about some of the early work I did in trying to help people with trauma. The other issue that springs to mind when I think about this is a lot of people try and help themselves with this. What can I do to fix myself? What can I do to work through this? Often the answer is very little. You need to work with someone, and then you need to help yourself after that. There is a bit of a movement in the EFT world to do it all yourself. I think that's a bit strange, considering that a lot of these blocks are unconscious. They're actually out of our awareness. How would we know? If you have a chance and you're working with someone with a traumatic event, it's extremely helpful to teach them EFT on a neutral subject before you dive into the deep end of the pool. So I usually pick a physical thing like aching or discomfort or body tension, and you train the person in EFT and how to do it. That introduces them to the relaxing effects of EFT and actually teaches them the very simple algorithm. So when it comes for the time for the hard work, they never have any doubts about the actual technique. And you can actually abandon the thoughts of being clever, forget about the technique, and just do all the work with the person, while in a kind of mechanical sense, you're just doing a lot of tapping. That's my preferred method. Very often with trauma, you're not seeing someone soon after the trauma, you're seeing them many, many years later. The trauma is quite fresh. In Australia they have a t-shirt, it says, you're born, life's a bitch, and then you die. This is the Aussie description of traumatic stress. You know, the world is a tricky place. Who's read that book by Alice Miller, The Drama of Being a Child? Who's read that? Yeah, it's a fascinating book, full of examples of how, just in ordinary life, children are not validated or even understood, let alone accepted by their parents. We all do this. We all do this. And we can't know what that does to the inner world of the little person. It's usually quite difficult, quite traumatic. These beliefs are way outside awareness and even consciousness, but they're around somewhere when you do the tapping and you come to them. I was very aware that there are a lot of these issues with Ree when we were working, but they don't actually need to be talked about. if they're there, you can work with them, and you might find out later on, or you might not. And I hope it was clear that I wasn't in any hurry to achieve anything here. What's the rush? What's the rush? Sometimes there's a pressure with EFT because it's so incredibly effective. The pressure is to do. It's only a technique, it's only a tool. What about just being with and doing a whole lot of tapping and see what happens? Knowing EFT has given me a lot more confidence just to be with the person and just to see what happens. And you get a lot of surprises. Sometimes issues like this can resolve very, very quickly because they're not the issue you thought it was. Sometimes they're unresolvable, but that's okay. You can't answer everything. And it is a body work. You're working in the body. Who else here likes or uses the idea of continual tapping? Anyone? Well, I actually think Gary's right into it now. He hardly ever stops. Isn't it great? Why should you stop? It's only the mind that wants to think about what was said and do a bit of processing and you know, points, levers, whatever. Why not keep tapping? Why not let the processing keep going? I think it's very important. I have a dream that in my futuristic tapping clinic, the person comes in and lies down and teams of 8 or 10 people tap on every point they can find. Why do you just have a bit of a chat and an hour later it's all over? Who's familiar with the tearless trauma technique? Everybody read that on Gary's website? Great idea about tearless trauma. The idea of treating a trauma from 1 or 2 or 3 steps backward in your inner world. You don't go to the trauma, you actually imagine what the intensity would be and treat that imaginary figure and then do repeated sequences until the imaginary figure is very, very low. Then when it's really low, maybe 1, you actually go to the real thing and see what happens. In theory, you're ready to work at that point with the real thing. I have found that in groups that can be a little bit tricky. So I'm very happy to do it in groups as long as there's people around to treat the people that can go to a 10 immediately the minute even they do it from 3 steps back. But generally speaking, it's a great way of approaching a problem. And there were elements of that in my session here with Ree, working from 1 or 2 or 3 steps backward, also coming into the problem and then coming out again, contact, withdrawal, just a symbolic way of working without overwhelming the person. There are sort of waves of the intensity and the waves go up and down. I hope you noticed in the session there were a lot of metaphors that reused. She was really switching back and forth many times between the role of a mother and a helper/therapist. We all do this. But what's the real role here? It's really the mother. And then there's the person. A lot of mothers never get round to their own needs until the kids have grown up. And actually, it reminds me of that really funny cartoon. I used to have it in my office, a pair of 90-year-old parents huddled around the divorce counsellor's table. And the counsellor says, "Why do you want to get divorced now?" I said, "Well, we just wanted to wait till all the children had passed away." Gary talks a lot about guessing, talks a lot about intuition. I've made so many mistakes in my life by trusting in my thoughts. I don't do that anymore. It always leads me astray. I trust my intuition. I've made some mistakes, but they haven't been nearly as bad as the ones I've made with this. So if your intuition, if your instinct, if you're guessing, if your gut tells you that this is an issue or this is useful and helpful, go there. Go there in this kind of work. I recommend it. Who's read Gary's article on his website about treating children with EFT at night? Isn't it lovely? A little routine for children. They're lying in bed and it's night time and they've had their dinner and their bath and maybe their story or whatever, and And they're just going through what happened in the day while mum or dad is just tapping on the points. And children are so quick. So they're actually letting it all go. They're actually releasing it before they go off to sleep. Wouldn't that be a great way to go to sleep every night? So it's a kind of very loving thing. The parent is tapping on the points while the child falls asleep. I can't think of anything better. As Steve Wells, my colleague, says, always treat yourself before you treat your child for any kind of real or imaginary trauma. Treat yourself, your own anxiety, for their getting better. We're always far more concerned about what happened than sometimes we need to be. A lot of blocking beliefs pop up in this kind of work. I think most people here are familiar with that idea. It's just another problem, just another difficulty. Sometimes you can put it into words, sometimes you can't. But it absolutely fills up the person's system, and everything about them reflects and manifests this. So you actually perceive it even if you don't know what it is. If you see someone you love coming toward you, you can tell from 100 yards away how they are. You can. And even on the phone, the slightest little thing, it's always like, what's wrong? You can tell. So you need to develop that sensitivity to focus in on the client or the person you're helping. And if you develop that very acutely, you'll be doing such good work because you'll be fully aware of something even if you don't know what it is. In medicine, we were trained to actually find out what was normal. And then if we found something that wasn't normal, we'd be alert. I always remember we were taken into as students to the bed of a lady who was very, very sick. Well, we were just taken into the bed, and the big boss said, I want your diagnosis when we come back out of the room. So we all got to have a look and think, and we all went into another little room. He went through the group of 7 of us, and none of us had a clue what was happening. Of course, we're only young students. And he said, well, is she sick or is she well? Oh, she's sick. He says, how do you know? Excellent question, because we knew. We knew the moment we walked in. But it took him to drag out of us what we had seen in an instant. And there's a lot of that in this kind of work. And the mind gets in the way, it really does. So you use that intuition and go with it. It's Larry Nims taught me that it's universally true that when people have a problem, after a while they get very cranky with themselves for having it. I should have handled this better. I shouldn't have had it in the first place. Actually, that part of it can be bigger than the original problem. It's huge. So we talked a little bit about being a bad mother. That's universally true for every mother. What can you say? If it isn't, I'm just thinking of the biggest problem for the average woman. It's not the husband, it's like the guilt about your own mother or whether your mothering is good enough. It's just huge. A lot of men don't feel much guilt. I felt some about 72, but it passed pretty quickly. But I understand that a lot of women feel it a lot. So what's the consensus in the room? Who agrees that women feel a lot more guilt than men? Whoa. Who thinks that's not true? No hands. All right. So women have a monopoly on this. I don't know why. Do you know why? No.
Because we've been taught that we're the main. Our experience is that we're the major caretakers of children, and so if anything goes wrong, it must be our fault. We didn't have a good relationship with our husband, we worked too hard, we weren't there, we did, so guilt and blame.
There's that groaning. Thank you. I'd just like to say a little bit about forgiveness because it's a complex topic and very much misunderstood. Hi, Gary. Gary says true forgiveness is the aim of all healing, and of course it's a spiritual question. I think of Gary as forgiveness in action. Sorry, I had to bring you in, Gary. But not everybody has that facility. Not everybody is connected. A lot of people want the spiritual bypass. I forgive you. What a load of rubbish. There is so much to do before you get to that point, so much. anger and resentment and frustration and difficulty? Go ahead. Can you put Gary on?
Hold on. Forgiveness is interesting because there's two definitions of it as far as I can tell.
Yeah.
One of them is the definition let's say I come and I kick you in the shins.
Yep.
Or better still, you come and kick me in the shins. And I go, oh, that hurts. I don't like you anymore. And I'm mad at you and so on. Why did you do that? And I'm not in a very forgiving mood. But later on, things mellow. And I say to myself, well, I'll go make friends with Dave. And so I say, Dave, I forgive you. Okay? And which means we can be friends, we can walk and we can talk and so on, But have I really forgiven? That's what's interesting. Have I really forgiven, or am I going to keep it in the back in my little quiver of arrows and things and keeping score? And the next time you do that, I'm going to bring it up. Okay? So the practical way of forgiveness in this separated world is to do what I said. We say we forgive, but we keep score. Okay? In my view, and this is the Course in Miracles view too, the true nature of forgiveness is actually and literally something we cannot do in this state, and that's to forget like it never, ever happened.
Yeah.
And that's where the true peace comes in. When you're keeping score, it's not true peace, and it's not true forgiveness. That's how we practice it here.
Yeah. Thank you, Gary. I'm going to wind up a little bit early, and I just want to say, unless we have more questions, because it's been a long day. I mean, haven't the other presentations been excellent? Yeah. Before I came on, I really felt like changing my name to Steve. To be consistent, I want to put in my 2 cents worth about depression. Now I'm going to use up all the credit I've engendered in this whole 3 hours because I have something to say that some of you may not agree with. In my own experience, with an open mind, treating all the people that come to me with depression, and boy is that a part of post-traumatic stress, I find personally, regardless of the cause, when someone has moderate to severe depression, that I can't really get any good work done with them, including the energy therapies, until that depression is treated and that depression lifts. Now the only way I know how to do that is to use an antidepressant that works. And that's what I do. Now this might not go down too well with a lot of people that think, well, let's treat the depression properly with this method or that method, or you name the method, I'm open to it. I've looked at everything, but I can't get those methods to work, and I don't know any other way to do this currently. I no longer try and help people with moderate to severe depression unless that depression is treated effectively. It is just too difficult and too humiliating and traumatizing. Go ahead, Pat.
I absolutely agree, and I'm so glad to hear you say that. I have refused 3 people recently to treat them because they had really quite severe depression, and they had done nothing about the antidepressants. And I have maybe 1/3 of the people that I treat who are depressed, or who 1/3 of the people I treat almost are on antidepressants for a while. And the facilitation of the EFT and the whole treatment is tremendous.
Yep.
It's just a myth that they should be, that every bit of work you do should be allowed to be washed away the way waves come in and wash a sandcastle away, is what happens when you don't have that support.
That's
so I'm
right.
so glad to hear you say that.
I had many, many years of working with people with moderate to severe depression where the very next day it was all gone.
That's right.
It's so humiliating for that client. Anyway, if anybody knows a method to treat, heal and cure moderate to severe depression, please let me know right away. I'm deadly serious. Mild to moderate depression, that is different. That is completely different. Do everything you know how to do. But for the time being, I'm using a good modern antidepressant, very few side effects, but I'm not going to talk about that. I'm talking about people getting better. That's where I'm at currently. Deborah. Oh, I'm sorry. Yes, Kathy.
You've heard from the therapists. You ought to hear from the patient.
Go ahead.
I had the depression and euphoria swing thing going on. And when I was normal, I could do all of the positive thinking and the creative visualization. And then when the depression hit, it was gone. I couldn't do any of those things. And yeah, it's kind of upsetting to take a little pill and be a normal person again. And yeah, I would probably have preferred to have, visualized myself to pure health. But that is not what happened. I have a little pill that I used to take every day, and it made me a normal person. It made me open to these things. I've been doing EFT on myself for a year. I don't have to take the little pill anymore, but I have a bottle of them at home, and just in case. My husband says, maybe you should take your pill. It really does help. It is not the horrible, awful, wicked, evil thing that so many people think it is. It can help.
Thank you. Deborah.
I certainly have no objection to antidepressants. Before I learned the newer methods, I was trained classically. I was trained in the Baltimore Washington Institute for Psychoanalysis, and I did very conventional Freudian psychotherapy for a lot of years, and I certainly was trained in the medical model, and most of at that time I called them patients. I don't call them patients anymore because I don't think medical model at all. But at that time, patients were seen by psychiatrists before they came to me. I'm not an MD. And I think most patients were on antidepressants or other medications. And I currently have no objection to them. But I have found since I started using these methods that most people who come to me on antidepressants want to get off them very soon after being with me. My first introduction to these methods was traumatic incident reduction. And I worked with one person who had been on antidepressants for close to 30 years. He had many traumas and came to me for, I don't know if it was 4 or 5 days, a block of time. He was from out of state. And we worked 4 to 6 to 8 hours a day, depending on our energy levels, using not only traumatic incident reduction, but other forms of metapsychology. And at the end of that period of time, he wanted to just stop the medication. I advised him not to, that he needed to titrate down and see his doctor, which I don't think he did, but he was finished with it. And then when I learned EFT, I found the same thing. People came on medications, and I never discouraged that, but I find that people get off them very quickly. So I think I'm a bit more conflicted about it from what you just said.
It's crucial to work out the level of depression.
Yeah, this is true. And I rent space at a psychiatric hospital and am often called to go onto, well, I used to be called to go onto the units to work with severely depressed people, and found that the EFT or other methods like this were helpful. But you're right, you have to figure out what that level is. I experience myself as having worked with some of the most severely depressed people. So I just have a little bit of an inner conflict with that from my experience, yet I wouldn't discourage anyone from taking medicine.
Well, I'm open to any method that will, improve and increase the cure and healing rate. I'm just saying where I'm at right now. I'm sure things will change. Thank you for that. All right.